Good afternoon, and thank you for joining me for our weekly update. Today I am joined by Dr. Lawrence Lowe, our Medical Officer of Health for the Region of Peel, and Tim Beckett, our Chief of Mississauga Fire and Emergency Services and our Director of Emergency Management. Like so many Canadians, I've been watching what's been happening south of the border. The protests in the U.S. are the culmination of pent-up anger, frustration, and fear of a system that permits far too much discrimination and death. In Canada, we are far from blameless. We should not look south and be smug, but look inward and realize that we have much work to do in our own country and in our own city. I want Mississauga's Black community to know that I hear you, I see you, and I stand with you. We need to address the systemic racism, full stop. Only when Black lives matter will all lives matter. We cannot and will not ignore the incidents between police and the public have disproportionately affected members of the Black community. Now more than ever, we need to take action and preserve the public trust, while at the same time allowing police to do their jobs effectively. Which is why at our next board meeting, Mayor Patrick Brown of Brampton and myself will be moving a motion to explore the use of body-worn cameras for Peel Police. Chief Duriappa is supportive and eager to embrace this new technology. It is our hope that this will help increase transparency and trust between the police and the communities that they serve. These cameras will not fix all our problems, but they are one tool that can be effectively employed to modernize policing and help address systemic racism. A vital step before any other steps are taken will be meaningful engagement with our Black African and Caribbean communities. I, along with Mayor Brown and our Chief of Police, will be partnering with organizations across Peel to host a series of meetings focused and listening to the voices of the Black community and receiving their direction on how we can work to better dismantle anti-Black racism in Peel. As your allies and as community leaders, we will be listening and we will be acting to implement the changes needed to address the anti-Black racism in our city. This work will commence in the weeks and the months to come. We must affirm Black lives matter until our system truly recognizes that they do. And until we are rid of systemic racism and until all people are truly free and enjoy the same opportunities. We are now in the third month of this pandemic, and while we have isolated the majority of spread in our community to household and workplace clusters, nearly 1/3 of all new cases in the province last week were reported in Peel. While I wish this wasn't the case, Peel remains a hotspot. I know this is really starting to wear on people, but the pandemic is not yet over, and our jobs are not yet done. We must continue to fight to limit a second wave and preserve the capacity in our healthcare system. You've heard me say this many times before. The situation here in Mississauga and across the GTA is much different than in the rest of the province, which is why I will continue to advocate for a regional approach to reopening, especially as the province starts considering some of the wider reopenings of workplaces and public gatherings in Phase 2. I welcome the province's new expanding testing strategy and the Premier's commitment to exploring a regional approach to the reopening. I agree with him. We can't manage what we can't measure, and I look forward to hearing more about what a regional model for the GTHA might look like. I also encourage him and the Minister of Municipal Affairs to work with the Prime Minister to deliver new money for cities to help us cope with this crisis. While I want to thank the Prime Minister for recognizing that the municipal financial crisis is a national financial crisis by advancing the remainder of our gas tax payment, this is not new money, but our COVID-related losses are new and they are very real. This money will not help us address our operating losses as a result of the pandemic. It is an advance on our allowance and has already been allocated. We need the provincial and the federal governments to put politics aside and work together in the best interests of Ontario's 444 municipalities. The Premier has been very vocal and receptive to the needs of cities, and I encourage him and the other provincial leaders to come to the table and work with the federal government to develop a funding plan, a funding formula that will work for municipalities. A strong recovery requires strong cities. We are the economic engines of our provinces and of our nation. Premier Ford and Prime Minister Trudeau, please do not let cities fail. You have the borrowing power and the fiscal firepower to do this. We do not. Extraordinary times call for extraordinary measures. Our local economies are powered by our local businesses, and the vast majority being small businesses. Many business owners are our friends, neighbours, and family members whose livelihoods have taken a significant toll as a result of the pandemic. If our city can't recover, our city cannot recover if our businesses can't recover. Their survival will be critical in our efforts to reignite the economy. We want to make it easier for you to support local, which is why today we are launching Mississauga Made, a virtual marketplace where our local businesses, artists, and vendors can promote their products and services to the public. I encourage our business community to join this movement, and similarly for people in our city to visit mississaugamade.ca to show their support by buying local. This crisis has also changed how we do business and how businesses must adapt. In particular, it has highlighted the importance of e-commerce and having a digital presence, especially for our local independent businesses, which brings me to another exciting new initiative which we are launching. Mississauga is proud to be joining with Digital Main Street's Shop Here program, as one of the first cities in Canada to do so. This program will provide our independent businesses and artists with resources to develop and launch customized online stores at no cost. It is powered by Google and supported by Shopify and comes at a critical time in our efforts to help our small business community recover from this crisis. I encourage all eligible businesses to please take advantage of this program and the added training and support that comes along with it, such as digital marketing and inventory management that will ensure the ongoing success of your online shop. We've seen our business community step up in a big way during this crisis, from retooling to create PPE and medical devices to donating meals and services to our frontline workers. And now it is our time to give back to them. In the weeks and months to come, I encourage residents to think local, to buy local, and to help our local businesses bounce back from this crisis. As you can see, we continue to keep our city moving despite these uncertain times. Today, Council hosted our 10th virtual meeting where our discussion focused heavily on planning what our recovery will look like here in Mississauga. At the outset of the pandemic, we made the decision to temporarily pause committee meetings. We are now in a better place to host these meetings again, although virtually, starting with our Planning and Development Committee and Committee of Adjustment. These departments, the departments that work to support these committees, have remained fully operational and are working at full capacity throughout this pandemic. As an example, our Planning and Building Department have completed nearly 27,000 building inspections and issued nearly 800 permits since the start of the pandemic. This represents roughly 85% of their normal activity and helps generate much-needed revenue in our cash-strapped city. Today, Council also made the decision to allow for a phased reopening of selected libraries for curbside pickup and returns at all locations starting at the end of the month. We know many have been using this as an opportunity to catch up on their reading, and we want to provide a safe way for residents to continue to access our vast collection of books. We also will resume issuing marriage certificates as of June 10th, which I'm sure will make many of our bride and grooms to be very happy. Applications must be made online, along with scheduling an in-person appointment to review all the necessary documentation. To be clear, while we resume issuing marriage licenses, we will not be offering officiant services here at City Hall at this time. More information can be found at mississauga.ca. And now I will turn it over to our Chief Medical Officer of Health, Dr. Lowe, to provide us with a brief update on Peel's response to the COVID virus. Dr. Lowe?
Thank you, Madam Mayor. As of noon today, Mississauga has seen 2,268 cases of COVID-19. Of these, 1,721 have recovered, 343 cases are still active, and 204 Mississaugans have tragically passed away. Mississauga, I want to remind you today of our collective goal. The weather is warming, and it's easy to get distracted. But we must remember that our foe remains in our midst. We have flattened, but we must end this first wave while we prepare for a second. There is still transmission of COVID-19 in Peel and in Mississauga. Having sacrificed so much, it would be terrible to let it all go to waste. Let's take the lessons that we've learned and work towards a goal of zero. 0 new cases of COVID-19 daily in Peel and in Mississauga. It's the goal that we have all shared since we started this journey together. Can we get there in the next month before summer gets into full swing? I want to tell you that at an individual level, each of you is making a difference, because the best way to stop new cases is to stop infection at its source. And we do this every time we get tested and then stay home if we feel sick. With every time we wash our hands or stay 2 meters apart. With every crowd avoided or non-essential trip turned into a virtual visit. With every moment behind a non-medical mask when we can't distance, like on transit or in grocery stores. By taking these precautions, each of you is stopping spread, saving lives, and pushing us closer to zero. Your efforts support the whole public health and healthcare system that is testing, tracing, and isolating. That is also crucial to our efforts, but it will not stop spread in the first instance. That is why Mississaugans cannot let up. We must remember the lessons we have learned and all do our part. For business and community leaders, I thank you for taking preventive steps to protect your employees and customers. And if you are just reopening, I urge you to follow the lead of the businesses who have gone before you. Making changes to your premises will also help to keep people safe. Finally, the data is increasingly clear. The most vulnerable in our society have borne the brunt of this disease. We have seen it amongst our seniors in long-term care homes, and we now see it in our racialized populations and communities that face structured disparities every single day. I know the terrible acts recently witnessed abroad have led to a desire to come together in speaking out. I too add my voice against oppression and state unequivocally that racism and discrimination have very real health impacts in our community that must be addressed. I only ask, though, that those who want to battle the very real health risks of racial inequity also take reasonable steps to protect themselves against the health risks of COVID-19. While avoiding crowds would be ideal, please remember that whatever you do, distancing, hand washing, and non-medical masks are now very much a part of public life. And please, stay home if you are sick. This is our new normal, and I repeat, everyone must keep taking these measures to get us to our goal of zero. 0 new daily cases. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And in closing, once again, I want to thank our residents for their patience and their understanding. I know the past 3 months have not been easy, but let's continue to make the right choices, look out for each other, and never lose sight of our common goal to keep our city healthy and safe and ensure that we never have to do this again. So thank you, and now I'm happy to take questions from the media.
Mayor Crombie, your first question comes from Momin Qureshi from 680 News. Momin, please go ahead.
Hey, Mayor Crombie. My question is, I'm well, how are you?
Very good.
My question is, this morning, Brampton Mayor Patrick Brown announced that they were making masks mandatory on public transit. That came just shortly after Brampton Transit said that it was going to strongly encourage. I know in Toronto it's not mandatory. They strongly encourage. I just wanted to know where you fall on that and whether you would consider making them mandatory for transit riders.
So currently, we strongly recommend that people wear masks when they are unable to safely physically distance, especially on mass transit such as our MyWay buses, where it would be very difficult on a MyWay bus to keep a 2-meter, 6-foot distance. We are bringing a report forward to Council next week, which will recommend a continuation of or restating our fare collection and front door boarding. Once again, we have provided additional protection to our drivers with a plexiglass shield at the front of the buses, and of course they have the option of wearing masks as well. We understand there may be a guideline coming down from Transport Canada very soon which will make masks mandatory, but there are lots of factors to consider, including making our transit drivers enforcement officers, and will they decline transport if someone didn't have a mask handy? Will we have to provide additional masks? There's lots of factors to be considered, but right now we strongly recommend that people do wear face masks, face coverings when they're not able to safely physically distant.
Just as a follow-up, what would it take for you guys to make the switch to go from recommending to mandatory?
I think we'll be looking for the guideline to be issued from Peel Public Health coming down from Transport Canada. But it's always been strongly recommended in any case.
Mayor Crombie, your next question comes from Ashley Newport at Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Welcome, Ashley.
So I know last week there had been a lot of talk about hotspots and particular hotspots in Brampton, and I know Mayor Brown revealed last week one particular neighborhood in Brampton that was considered a hotspot. I'm wondering if there's any, or if you know neighborhoods in Mississauga that consider, any neighborhoods in Mississauga that are considered actual hotspots,
yes,
or places where the COVID threat is more pronounced.
So I am going to let Dr. Lowe respond to this because he is working on the integrated map, but I will share with you that we are starting to see a stabilization, Ashley, and I'm quite hopeful. But in communities where we do have large household clusters, such as in areas in the north part of our city, like in Malton, there may be slightly higher incidents, but we have not seen the same dynamic occurring in our workplaces as they have in Brampton. And I will let Dr. Lowe address the question as well, Ashley.
Thank you.
Thanks, Ashley, for the question. As you know, Peel Public Health released geographic data in our weekly epidemiologic summary yesterday, and certainly, at least as it pertains to neighborhoods of concern in Mississauga, Mayor Crombie is correct in identifying certain neighborhoods in the northeast, particularly around Malton, where there have been a higher concentration of individuals who reside there who have had positive tests. It's really important to remember, though, that this does not indicate risk. Individuals can continue to circulate throughout our community, and risk exists everywhere, which is why everyone must continue to practice physical distancing, hand hygiene, and non-medical masking in settings where that's not possible. And it's also important to remember that geographic data is but one piece of data that we at Peel Public Health are looking to really determine the whole picture of the pandemic in our community. Thank you for the question.
And actually, my next question is for Dr. Lowe as well.
All right.
Before you run away.
No worries. I'm here.
Yeah, so just to kind of follow up to that, I know that over the past couple of weeks you've spoken about how a lot of the spread that we're seeing in Peel is coming from workplaces, in Brampton in particular, but workplaces in the region and also households in the region with a lot of residents. This seems like it's really challenging to stop spread in places where people have to work or where people have to live together. Is there any way that people who, do live in more crowded homes or apartments can protect themselves, or is there something maybe more that Peel or the province should be doing to help curb spread in these places where it's really hard to distance?
It's a great question, and it's something that we're actively looking at. We know that on other jurisdictions around the world, there were things like isolation hotels, which were offered to individuals who had tested positive, and certainly even things like providing personal protective equipment or assisting with training education around how to physically distance. There are resources online, especially for people who are COVID positive and who have identified as COVID positive, and then need to figure out how they can safely self-isolate at home. So I would encourage anyone who tests COVID positive to review that guidance. They can look it up, Public Health Ontario, how to self-isolate, and then they can also continue to take those steps while we at Peel Public Health explore some of the other options that may be used to control spread in our community. Thank you for the question.
Mayor Crombie, your next question comes from Steve Cornwall from the Mississauga News. Steve, please go ahead.
Hi, Steve.
Question about the body camera.
Yes.
Obviously, already, but I guess my question is why is this coming forward now, and how do you think this will kind of help with transparency and accountability for police?
So certainly, Steve, it's a great question, and Mayor Brown and I had the opportunity to be communicating all weekend long, and we're looking for ways to modernize our police force through innovation and looking at techniques that can provide greater accountability and greater transparency. And this all kind of came on the heels of what we saw transpire south of the border, and we thought this was one more effective tool. We discussed it with the Chief of Police, Chief Nish Duriapa, and he was quite excited about it because he's the kind of individual that embraces new technology and thought it would enhance transparency. And we saw that in the examples in the United States, particularly in Las Vegas, the use of body-worn cameras helped reduce the number of complaints of misconduct by almost 30%. So we thought this might be a very effective and perhaps a lower cost tool than some of the alternatives.
Just to follow up on that, a body camera, Toronto.
Sorry, Steve, you're cutting out. I just heard body camera in Toronto.
Hopefully you can hear me now. A similar program in Toronto has taken many years and also, tens of millions of dollars to kind of put together. How do you prevent a similar program from kind of taking so long to get off the ground in Mississauga and Brampton?
Well, we're very action-oriented here in Peel. So the first step was to consult with the Chief of Police. Next steps will be to take it out to public consultation with our Black community, certainly our African Black community and our Caribbean Black community, and we plan to do that starting next week, so we're on this. And then we plan to take whatever recommendations we hear, because we're going to be listening to them and listening to their advice and listening to their recommendations. Mayor Brown and I will take those recommendations to the next police board meeting for implementation.
Mayor Crombie, your next question comes from Tina Yazdiani from City News. Tina, please go ahead. Tina, are you there? Okay, we'll go to Isaac Callan at the Pointer. Isaac, please go ahead.
Hey, Mayor Crombie.
Hi, Isaac. Welcome.
You started your press conference and your council meeting today talking about anti-Black racism. And obviously in March, the province handed down a review of Peel District School Board, which found anti-Black racism throughout the organisation. It's the school board operates in Mississauga. Do you have a comment on that review and the actions of the board?
Yes, of course, I find this is very heartbreaking, particularly a mayor who prides herself at tone from the top, and creating a very warm, welcoming, inclusive, vibrant community where everyone is welcomed, where everyone has an equal opportunity to succeed. So seeing what has happened at the Peel District School Board, I spoke with the Minister of Education, Minister Lecce himself, who asked me if I thought he should go in to do the review, and I encouraged him to do so. And I also spoke with Chief of Police, and I know that they are also consulting with the school board on direction and providing advice. So this is a very difficult situation, and we need to come together now, and we need to come together with the Black community, and I'm sure we will be hearing more about the these issues, this issue in particular that relates to the Peel District School Board, as we do conduct our consultation on the body-worn cameras going forward.
Thank you. And my follow-up is on the announcements today and some of the discussion at Council. So things like the return of the Planning and Development Committee. They hint at a sort of a return to some kind of new virtual normal. And so I wanted to ask about the emergency powers that you got on March 23rd, if you still have them, and how much longer you think you need them for if things are starting to come into this slightly strange, futuristic normal.
Yes, it's a very good question. So things are I'm starting to see the light at the end of the tunnel. There seems to be the beginning of a stabilization here for us. So certainly I think the Premier is thinking about extending the emergency order through the end of June, maybe to the beginning of July, and I'm very hopeful that I will do the same, and I will, what's the word, not revoke, give up my emergency declaration at the same time the Premier does, once he declares that the emergency situation is now over with.
Mayor Crombie, we're going to come back to Tina, but her first question is for Dr. Lowe. We've got Tina from City News. Please go ahead.
Hi, yeah, I wanted to ask you about something that came up this morning during the Brampton update, that a high number of young people are testing positive. I was just wondering, do we have any idea where they're getting infected? Is this something that's happening while they're at work, or are there other details you can provide on what may be going on there?
You know, thanks, Tina, for the question. Again, you have to remember that a lot of what we're seeing in Peel Region are workplace as well as household clusters. And in respective workplaces, we are seeing a lot more working age individuals contracting COVID-19. Fortunately, as you know, the outcomes in that age group are not necessarily always as severe, although we do have 20 and 29-year-olds who do see severe outcomes and sometimes mortality associated with it. But a lot of it is driven, I think, by the fact that we have now seen the wave of this pandemic move out of long-term care and senior settings as the community has reopened into workplaces. And it's also important to remember that some of those are almost certainly driven as well by gatherings, and we do know, especially in Brampton, that there are, but throughout Peel, that there are issues with people who continue to disregard recommendations and rules to avoid crowding, to avoid gathering, and that is also another potential transmission risk that we are identifying and looking into, at least here at Peel.
Thanks so much for that. And my next question is for the mayor. I was just wondering if you could give us an idea of what kinds of cuts the city is looking at making if you're not able to secure more funding from the provincial and federal governments.
Tina, it's a wonderful question, because we will be facing a $100 million deficit if we don't get an injection of some operational revenue from the federal and provincial governments combined. So certainly that would be the equivalent of closing our city for 2 months, or closing down transit for almost 1 year, almost 11 months. So we would be going line by line in both our operations budget and our capital budget, looking at programs and services. And I'll say that nothing will be sacred. We will have to make some dramatic cuts. We would be otherwise facing a 17% tax increase next year, which is unthinkable. So we're very, very hopeful that the federal and the provincial governments have heard, are listening. They have come forward with assistance for individuals and for small and medium and large-sized businesses, for business continuity funding, and now it's time to turn their attentions to the cities. We are the economic engines, and just as the recovery begins, we would be forced to start making cuts to programs and services, and that's certainly no way to reignite an economy.
Mayor Crombie, your next question is from Khaled from My Second Home TV. Khaled, please go ahead.
Hi, Mayor. Mississauga is one of the best cities in Ontario, if not in Canada, when it comes to diversity. But when I hear systematic racism, it makes me wonder a little bit. Is it only when it comes to policing and Peel School Board, or is it in other specific areas, departments, or organizations?
Khaled, I think they call it systematic racism because it's in the system. It's pervasive everywhere, and there is that systematic, unintended, often I hope, bias that exists, and it exists in our places of our workplaces and throughout, just in all aspects of business and culture, right across not only the city, the province, the country, and you see it North American-wide. These are we are not isolated here to being suffering from systematic bias and systematic racism, and we will look to those examples from abroad and locally on how we address these issues. It's heartbreaking for me as well, especially one who prides herself on the inclusivity and the diversity of our city, where we all embrace each other and we celebrate each other, and to know that there are communities like the Black community and the Indigenous community, and of course we've seen incidents of hate amongst Muslim community through Islamophobia, through the Jewish community, through anti-Semitism. We see incidents everywhere, and these really need to be addressed very strongly.
Thank you, Mayor. My next question to Dr. Liu, please.
Thank you.
Thank you.
Go ahead, Khaled.
Dr. Liu, can you please update us on the contact tracing? Especially, we hear lots about failure here, failure there, or we are still a little bit behind, and we are getting mixed messages. Can you please update us?
Yeah, no, I think there are a lot of different commentators out there, and I think it's a good opportunity, it's a great question for me to make very clear that contact tracing is bread and butter public health. It is something that we have engaged in and have been ready to do since we went into emergency operations on January 23rd, and since we had our first case in Peel on March the 5th. We have doggedly tracked down all the contacts of all the positive cases that have been reported to us in the region of Peel, and to a large extent that has complemented the efforts of the broader community in physically distancing, in making sure that they're not crowding. And to that end, we've actually been able to meet the provincial benchmark of initiating contact tracing investigations within 24 hours of receiving a positive case. They say 90%, and we in the last count had initiated in 95.6% within 24 hours. So we are continuing to perform contact tracing as with any other public health agency in the world, and we'll continue to do so to protect our community. Thank you, Khaled.
Mayor Crombie, there are no further questions. This concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Our team will be sharing a link to today's press conference with you shortly. Have a great day and stay well.
Thank you very much.